Hi, I'm Paul, a team member at Pain-Free Physiotherapy and Allied Health. Today I wish to talk about a condition that has popped up quite frequently within our clinic, and that is sinusitis. Now, what is sinusitis? It's the infection or inflammation of our sinuses, which are air-filled spaces within our facial bones. Now, these areas can stem from the cheekbones, of course the nose, sometimes on the forehead, and sometimes in the eyes. People that are affected by sinusitis can have a whole range of presentations. So it could be something as simple as an irritation in the nose, perhaps, as you go about your day, actual facial pain. It could be accompanying headaches, it could be upper jaw pain, it could be coughs, it could be ear-related problems. So what are the sinusitis causes then? It could be as simple as irritation from a recovering flu, sudden seasonal changes, old or unknown allergies. These then all cause the sinuses to become inflamed or infected. Then the narrowing of the channels within the sinuses start to happen. These then result in painful sensations in the sinuses, as well as headaches and plenty more. Starting to sound familiar? So how is sinusitis managed these days? Well, there's a whole lot of treatment options out there available, and each tied to the specific cause of sinusitis. Some common ones are steam inhalation, anti-inflammatory medication, sometimes even antifungal medications. For really serious cases out there, persistent and painful, surgical intervention is primarily the last resort for most people out there. So this is where we come in. As an acupuncturist at Pain-Free Physiotherapy and Allied Health, we tend to go for a more holistic approach, as each case is vastly different from one another. This means that the acupuncture needles may be different from one person to the next person, and tailor-suited to each unique case out there. Typically, we see roughly a good result or a noticeable result the next day or even 2 days after the treatment. But wait, this is all interesting and good. What can I do in the meantime that can potentially help my situation with the sinusitis that I'm experiencing? So there is an acupuncture point to which you can access. It's called B-tong. This point is actually in the middle of the nose where the bone meets the cartilage, and I want you to use both your pinkies and point in a crisscross section like an X. Basically, I want you to hold a live pressure going upwards for roughly 20 to 30 seconds. You should be able to still breathe in and out in that duration. After that duration, release your pinkies and take in a breath or two. See if you notice any difference. If you still are experiencing problems with sinusitis, book in a session with us today at Pain-Free Physiotherapy and Allied Health.